side images, these are the blood pool images, and on the left hand side is the delayed phase. The patient has presented with the ankle joint surgery, and they have wanted to evaluate that ankle joint. So in what abnormality what we see is basically most common is the symmetry. In this we don't see that symmetry. You see some uptake is there in the ribs, then some uptake is there in the ankle joint, which is out of symmetry. And those same area, there is something uptake in the skull. Those same areas show increased blood pooling also. Here it is increased, the ribs you can see it increased. We did a 3-phase of the ankle joint. You see that there is increased uptake in the right ankle. Right? This is the anterior images. There is some increased blood flow, blood pool in the right ankle joint. Interestingly, that increase, the whatever blood we see, is not showing any increased uptake in the delayed phase. So that indicates that bone is not involved. Whatever inflammation is there, it is there in the soft tissue only. So we can comfortably rule out that at least in ankle the bone is not involved. Though other places, the ribs and whatever we are seeing, that shows that it is uptake. So anyways, patient has skeletal pathology, but per se that the ankle joint is not showing bone involvement. This is a case of multifocal vasculitis. Another very common indication is when the patient presents with spondyloarthropathy. Spondylolischitis. Patient presents with back pain, they get an MR done. MR will show some uptake in the end plates of the vertebrae. But what is that? Whether it is metastatic, whether it is infective, whether it is osteoporosis related. For that, bone scan plays a very important role. Again, this is the blood pool image and the delayed phase. You can see that there is some uptake in the lumbar vertebrae. In the same region, there is increased uptake in the blood pool. We did a flow. Again, you can see flow, there is some increased uptake in the between the kidneys in the same region where we have increased uptake in the blood pool. These are the static images. Delayed images, static images again between the kidneys, some uptake is there, between the kidneys, some uptake is there. So this was the 3-phase positive: increased flow, increased blood pool, and increased delayed phase positive. So this was a case of active spondylolischitis. Another case, same way, presented with the low back pain, did an MR, they had some doubt in that MR, they are sent for bone scan. We again did a 3-phase bone scan. In the delayed phase, you can see some uptake, but there is no increased flow. Blood pool also, it is almost nil. Only the delayed phase shows some uptake. So this was a case of osteoporosis related fracture. So bone scan can very nicely differentiate between osteoporosis and infection. This is a case of ankylosing spondylitis presented with focal pain, radiographs. You can see the dagger sign, bamboo spine. But now the patient has focal pain in mid-dorsal spine. What it can be? Again, the patient was sent for bone scan. We see that there is some specific uptake. Previously, this radiograph was opined as normal. After doing the bone scan, then again retrospectively seeing this meant that there is some sclerosis, some irregularity of the end plates seen in that region. So this was the Anderson's lesion, that is inflammatory spondylolischitis. As I told, inflammation plays a very role in spondyloarthropathy. Multiple joint pains, the patient presents with this. There is an increased uptake you can see in the sacroiliac joints. And then there is prominent uptake in the crossovertebral junctions, vertebral and neck. This was case of AS ankylosing spondylitis. Companion case, this also presents with multiple joint pains. In this case, these are the static images, blood pool images, and the delayed phase images. You can see all the places where there is increased uptake shows increased blood pool. So we can, doing this three-phase bone scan, we can very well tell that active inflammation is present. They need to increase the drugs, or if the patient is on steroids, they need to change it to DMARDs. The encephalopathy is very nicely can be depicted in the, this is the, it's the tendinitis, which can be very nicely seen. This is a very interesting case. It's a lady who presented with chest pain. She had gone to multiple doctors, but not diagnosed. They were giving medicines, NSAIDs. When she takes, pain is relieved, but again it comes back. They did radiographs or normal. They couldn't pick up anything in that. Then she was sent for bone scan. You see, they increased uptake in the sternum. So this is a case of chest wall enthesitis. What is chest wall enthesitis? Actually, if you see the chest wall it's an incredibly complex region. You will see there are a lot of multiple insertions in there, which gets inflamed in Gallagher spondylitis. The best thing is that these chest wall enthesitis, they are of short duration and outcome is very good if they are correctly diagnosed. Second thing is that you need not do any other investigation to prove it. So this is, we have to know that this is one entity which presents with an undiagnosed chest pain, and bone scanning is a very important role in this. This is a 21-year-old female, known case of sickle cell. She already has known bone infarcts, but now she is presented with new onset knee joint pain. To rule out what it is actually, like whether any active infection is there or not, they did a bone scan. So you can see in this case, in the left hand side is the blood pool image, and right hand side is the delayed image, because we can see the bones very nicely. And we can see some uptake is there, in the ribs is there, in the knees it is there, which shows increased this blood pool. In this case, as we have a facility of SPECT CT, we did a SPECT CT. So you can see that all these are the signs of bone infarction. And where, I don't know whether it is evident in this or not, but there is a break, vertical break, which is showing increased uptake. As such per se, the infarction side is not showing, but the ends are showing the increased uptake. This is the coronal image. You can see that the patient is developing avascular necrosis of femoral head. The bone infarct which is present in the neck, that is not showing any uptake, and she is developing a new onset infarction in the right femur. So this was the finding that active infection has not developed in the places where the bone infarct is there, along few inactive bone infarcts. This patient also, he went to multiple places with non-surgical. He had the pain in shoulder joints, pain in the hip joint. Then he landed in inflammation, and we did a three-phase bone scan for this patient. As you can see, it is a flow phase, very little of uptake. Pool we did for some uptake is there, some the blood flow is also, this blood pool is also a little bit increased. The SPECT CT showed that mainly the uptake is there in the region where we see some subcondylar sclerosis. There is even the loss of this joint space. There is some the contour of the head is also a little bit, it is deformed. So this was case of avian of the hip and the shoulder joints. You see the images. You can see there is some increase of taking both the humerus. So this was basically case of bilateral avian of the bilateral humerus and the femur. This case, patient had a history of road traffic accident 1 year back, for which